This is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. Rwandan's health authority says consistent use of treated mosquito nets and indoor residual spraying preventive interventions has helped the country slash malaria cases by 71% between 2016 and 2021. TOS News recalls that the government recently received a $53 million grant from the Global Fund as a contribution towards a whopping 295 billion Rwandan currency, equivalent of $280 million required in malaria prevention and treatment efforts running between 2020 and 2024. At least 37 people have died from a recent cholera outbreak in Jigawa and Enugu states, and more than 2,000 people have been hospitalized in the past 2 months in the state. 30 people died from the infection in Jigawa state, while 7 people died in Enugu state. The Permanent Secretary, Jigawa State Ministry of Health, Dr. Salisu Muazu, who confirmed the outbreak, said most of the infected cases were children recorded in 9 local government areas of the state. And China has said there is no sense in World Health Organization's plan on second phase of coronavirus origin tracing, which focuses on lab leak theory. China's deputy head of the National Health Commission, Zheng Yijun, made this known on Thursday, adding that the country will not follow the World Health Organization's suggestion. According to Zheng, I was surprised when I saw WHO's origin tracing plan for the second phase. He said the plan has set the assumption of China leaking the virus due to violating research instructions as one of the research priorities. And also still from China, a lab study has shown that COVID-19 vaccine produced by Chongqing Zhifei biological products have proven to be strongly effective against the Delta variant, but revealed a slight reduction. However, they cautioned that the data from clinical trials or real-world use were still necessary to determine how well the shot can prevent people from getting sick by the variants. Scientists and regulators are watching closely to see whether the Delta variant, which is significantly more contagious than the original variant of the new coronavirus, will render available vaccines and treatment insufficient. At least 4,300 people have reportedly died from growing epidemic of the deadly black fungus in India amid the COVID-19 crisis. India's Health Minister Mansukh Mandavia said 45,374 cases of the rare and dangerous infection called Mucormycosis have killed people in the country. The infection attacks the nose, eyes, and sometimes the brain, and usually strikes 12 to 18 days after recovery from COVID-19. Doctors say the fungus have a link with the steroids used to treat COVID, and diabetics are at a particular risk, adding that antifungal injection is the only drug effective against the disease. And this is TOS Television Network, and you're watching Health 54. To stay tuned. Welcome back. Chinese National Health Commission last week announced its first year-on-year drop of HIV and AIDS cases in a decade. According to officials' report, over 62,170 HIV and AIDS infections last year dropped to about 9,000 from 2019, where 71,204 cases were reported. However, HIV and AIDS remained the deadliest infectious disease in the world, with more than 18,800 people dying of AIDS-related illnesses in 2020, according to an annual Health Development and National Health Commission communique, which was recently released. A 53-year-old veterinary surgeon in Beijing and the first human case of the monkey bee virus have died from the disease, according to a report published by the Chinese Center for Disease Control and Prevention. The surgeon had worked in an experimental research institute specializing in non-human primate breeding. He dissected 2 dead monkeys in March and experienced nausea, vomiting, fever, and neurological symptoms a month later. It was gathered that the patient visited several hospitals but died afterwards. And the Nigerian Center for Disease Control on Wednesday reported 2 deaths and 238 new cases of the coronavirus disease. The NCDC made this known on Wednesday on its official Facebook page of the Nigeria Center for Disease Control. Following the new data, the country's Disease Control Center revealed that the total infection figure in Nigeria now stands at 170,122, while the death toll is 2,130. The Federal Capital Territory Administration says it has mounted surveillance at recreational parks within the territory to enforce the laid-down protocol of COVID-19 in Nigeria. The head media and publicity of FCT Ministerial Committee on COVID-19 Enforcement, Ikaro Atta, made this known on Wednesday during a monitoring exercise at the Abuja Millennium Park. Atta said the administration won't lose its guard on the control of the ravaging virus. And Pfizer BioNTech and South African-based company BioVac have struck a deal to produce 100 million doses of the coronavirus vaccine annually to be used for African Union countries. In a statement published on Wednesday, the 2 companies said Cape Town-based BioVac will complete the last step in the manufacturing process known as fill and finish of the BioNTech Pfizer vaccine. The ingredients for the production of the jabs will arrive from plants based in Europe, while the manufacturing of finished doses will start in 2022. That is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.